Okay, so this is how we do a presentation. Normally, I'm talking to somebody who's brand new to Medicare, somebody who's turning 65, somebody who was referred to me, or somebody who has been collecting disability for 2 years and they need to get on Medicare. So I call them, hey, Ted, this is Carlos. I'm the Medicare specialist. Okay, great. Refresh my memory. How did we get a hold of each other? Who referred you to me? They tell me who referred them to him, referred me to them. Okay, great. I'm assuming that you're turning 65 here pretty soon and you'd like to know what Medicare is all about and what your two primary Medicare options are. Is that right? Yes. Okay, perfect. So, John, Ted, this is what we're gonna do. I'm gonna do a 30,000-foot overview of what Medicare is all about. I'm gonna show you what your two primary options are. I'm gonna tell you how much it all costs, what's good, bad, and ugly about both primary options. And at the end of it, you're gonna be somewhat of a Medicare expert, and you're gonna be able to tell me what you want to do and if you want me to be your insurance agent. Is that cool? Okay, great. So Ted, if the best way for me to do this is if you're anything like me, if somebody's trying to teach me something or show me something, if I can see it at the same time, it just makes 1,000% more sense. So can you get in front of a computer, or can you download the Zoom app on your phone or tablet so we can do a screen share? Is that possible? And then they're going to say, yes, okay. I'm going to say, what are you using? Are you using your computer or are you using your phone or tablet? Okay. If they say phone or tablet, then I'm going to say, okay, great. Then do me a favor. Do you have an iPhone or an Android? Oh, I have an iPhone. Okay, go to your app store. Oh, no, I have an Android. Okay, go to your Google Play Store and search for the Zoom app. So go to search, type in the word Zoom, and click on the icon that has a blue logo with the word Zoom in white letters. Okay, you found it? Great. So go ahead and download it. And then tell me when you opened it on your phone. Okay, great. You opened it? Here, let me. Tell me when you open it on your phone. Okay, Carlos, it's open. Okay. There's going to be a join button there. Click on the join button, and then it's going to prompt you to type in your meeting ID or code. Do you see that? Okay, great. So the meeting ID is just my phone number. Are you ready for it? Okay, great. My phone number is 779-875-9786. And then click join, and then voila, magically you're going to be able to see my screen. Okay, great. If you want to turn on your camera, great. I like to see people, but you don't have to. Okay. So they join in, and then Zoom will notify me when they're actually looking at my screen. Right. It says, hey, participants are seeing your screen. When I see that, I say, okay, great. Do you see your name in the middle of the screen, Ted? Do you see your name in the middle of the screen? And I zoom in. They say yes. Okay, great. So this makes everything 1,000 times easier, Ted. That was the hard part. Okay. So that's how I get them into the screen share. Okay, I walk them through the process. Okay, download the Zoom app on your phone, open it, click join. Here's my phone number. Voila, you're magically going to be able to see my screen. Okay, if they're doing it from their computer, I'm just sending them an email with my Zoom link, right? So go to your email. I just sent you an email with my link. Okay, click on that link, and it's going to prompt you to download and run the program. Go ahead and download and run the program. Do whatever it is you have to do to get it going. Okay. Now they're going to ask you to type in your name. You can type Bob. You can type Bob in there. Doesn't matter what you type in there. Go ahead and type it in. Okay, great. And then click the join button. Great. It's going to ask you if you want to join audio. You can say no because we're already on the phone. We're already talking. Okay, great. Can you see my screen? Okay, great. Like I said, this makes everything 1,000 times easier. Okay. So Ted, let me pull up some of the things I need to go over this this overview. I'm going to pull up my Medicare 101 presentation, and I'm going to pull out my Medicare and You guidebook. Okay, great. So the presentation is coming up. I go over to the one that has the the card on there, and I just leave it right here. I say, okay, Ted, can you see my screen? Great. Okay. So this is original Medicare. This is what we call the red, white, and blue card or original Medicare. Folks who are turning 65, they become eligible for this bad boy right here. This card comes in two parts. It's part A and part B. Part A is hospital insurance, Ted. This means that if you were formally admitted into the hospital, all the bills are going to be ran through your Medicare Part A, okay? Part B, let's just call it everything else insurance. When the doctor walks into your hospital bedroom, he has a bill. When you get lab work, they have a bill. When you get x-rays, they have a bill. Everything else is going to be ran through your Medicare Part B, okay? Part A doesn't cost you any money, Ted. You've worked here all your life. You've paid into, usually doesn't cost anybody any money. You've worked here all your life. You've paid into FICA taxes for 10 years. You've earned your Medicare credits. The Social Security will give us Part A, what they call premium free, $0, okay? However, Part B is not free. Everybody and their mama has to pay a standard premium, and that standard premium is $164.90 a month. That's damage number one, okay? Step one is getting this red, white, and blue card in place. Okay, so let me ask you a question. Are you already collecting Social Security? Yes, Carlos, I'm collecting Social Security. Okay, so Social Security will send you this card 3 months before your 65th birth month. So you're turning 65 next month. That must mean that you have your red, white, and blue card. Is that right? Yes, Carlos, I have it right here. Okay, perfect. If they say, no, Carlos, I don't have it right now, well, you're collecting Social Security, right? You should have it. You likely threw it away or misplaced it. We'll call later on to find that Medicare number somewhere in the universe, okay? So no worries. If they say, no, I'm not collecting Social Security, okay. So for folks who aren't collecting Social Security, you have to be aware that you're turning 65 years old, and you have to be aware that it's time to enroll into Medicare. And you have to actively enroll yourself. So there are 3 ways you can actively enroll yourself, Ted. You can walk into the Social Security office, and they can, after maybe an hour wait, they can take care of you and enroll you into Medicare. You can call the Social Security office to make an appointment. That appointment is usually made a month and a half later, and then you have to make your appointment, and they can sign you up over the phone. Or you can do it online. And this is where we help you. This is where we come in. Insurance agents like ourselves will help you enroll online in about 15 to 20 minutes, okay? Step number 1 is getting that red, white, and blue card in place, okay? So when that time comes, when we get to the end, and if we're ready to do this, we can take those steps, okay? So everybody knows that this red, white, and blue card covers about 80% of all the doctor and hospital bills. So the question that everybody will ask us is, hey, Carlos, who's going to help me cover the other 20%? Who's going to help me cover, the extra bells and whistles that we lose when we're finally retiring, like dental, vision, hearing, cancer policies, all that jazz? And this is where insurance agents like us come in. Insurance brokers like us come in, and we show you how to fill in the gaps or find or get those extra policies, okay? So pull something else up here. This is the Medicare and You guidebook. Have you gotten this in the mail yet? Everybody who's eligible for mail for Medicare will get this Medicare and You guidebook in the mail every year. This is the book that is given to us by CMS, the Center for Medicare and Medicaid Services. Okay, Ted, it's 128 pages long. You can read the whole thing. You can learn a lot of things about Medicare. I'm just going to point you to some important pages. Okay, important page number 1 is page number 10. This is where it says, hey, John, you have 2 primary Medicare options. You can go with option number 1 on the left-hand side or option number 2 on the right-hand side, okay? Option number 1 is literally walking around with 3 insurance cards in your pocket. The first card is your red, white, and blue Medicare card. That's your primary insurance. The second card is what we call a Medicare supplement, also known as a MedicareApp policy. And the third and final card is your Part D prescription drug plan. This is the card you show at the pharmacy if you need to pick up some medications at the pharmacy, okay? So what I'm going to do is I'm going to get you your quote for your Medicare supplement, your Part D prescription drug plan. I'm going to tell you how it all works together with your red, white, and blue card. And then we're going to forget about it. We're going to put it off to the side, and we're going to talk about option number 2, which is called Medicare Advantage, also known as Part C. Okay? So let me get some basic information from you, John. Okay, tell me, Ted, tell me the city, state, and zip code that you currently live in. Chicago, Illinois, 60634. Okay, perfect. What county is that? Cook County. Okay. And tell me again when your birth date is? 8/2/1947. Okay, perfect. All right. So let me grab this zip code. I'm going to grab the zip code and I'm going to go over to my quoting tools. Give me a second while I get all the way in. So I'm going to MedicareCenter.com. I'm logging in. And the first thing I'm doing, clicking this off and going here, the CSG app. Okay. CSG app. I click on it. I'm waiting for it to load. Okay. Second thing, and probably most important thing, is to toggle this logo. We want it to say Premier because that's where we're contracted. So toggle over Medicare Center, click on Premier, and watch it change a different color. This is the color that we need it to be. Okay, perfect. All right, so we're looking for Medicare supplement quotes, Ted. Let me get in there. Let me type in your zip code. Okay. Cook County. Okay, perfect. You're how old at the moment, Ted? 75. Let's pretend you're 64 going on 65. Let's say you're 60, so you're 65. Okay, perfect. Okay, and then male last time you checked. And then your birth date is in August. Okay, so just so you know, Medicare will always start the 1st of your birth month. Okay, so your Medicare is going to start August 1st. Okay. Now, us as insurance agents, we know that the caveat is if you're born August 1st, it starts the month prior. Okay, but we don't have to let them know. Okay, August 1st. Okay. Now, John, I want you to see something. Medicare supplements, they come in all different flavors. They're lettered from A through N. Okay. The most popular flavor is the letter G, and it has been the most popular flavor for the last 10 or 12 years. So just to avoid some confusion, we're going to go straight to a letter G, and I'm going to show you how it works, how much it all costs, how it all works together with your red, white, and blue card. Okay. So let's get a quote. Bear with me. It's popping up here. They're populating all the quotes. All right. So the first thing we do as insurance agents is they don't need to see all this expanded view, how many years are in the market, all that jazz. So right away, I click on to unexpand the views. Okay. So Ted, look at all these companies. Look at all these companies that are more than willing to sell us a Medicare supplement plan G. Okay. What you want to know is this. In this Medicare and You guidebook, on page 75, they start talking to us about Medicare supplements, Medigap policies. And right here, right in the middle of the page, it says Medigap plans are all standardized. What that means is it doesn't matter if you went with Allstate, Globe, AARP, or Joe's Chicken and Waffles. You'd get the same benefit from Joe's Chicken and Waffles than you would with any of the other insurance companies you see here. Okay, so what I'm supposed to do as your experienced insurance agent is I'm supposed to recommend one for you. I'm supposed to say, hey, I recommend this one because it's popular, it's affordable, it has a lot of people on the books. If it's popular and it has a lot of people on the books, imagine if one person got sick in that pool of people, the insurance companies have a much easier time spreading that bill amongst a lot of people than it would a smaller group of people. So what does that mean? That means that over time, the rates of increase tend to be less than the rest. Okay. We're not fortune tellers. We don't know how much they're going to increase. We just try to pick the right one up front so that we don't feel it as much later on in the future. Okay? So if I were to recommend one here, I'm going to say, you know, Medico is perfectly okay at $130.40 a month. Okay? So let me jot this stuff down over here. So I'm in his notes. Okay. Original Medicare, we already know, is going to cost us $164.90 a month, Ted. And now we know that our plan G is $134.40. $130.40. Sorry. Remember that this is our primary insurance. This is the one that covers 80% of all the doctor and hospital bills. And this is the supplement. Okay. So before we move on, let's shoot the big pink elephant that's in the room at the moment, because there's a couple questions that come up at this point. Number one, they say, Carlos, how much do you charge for your services? We don't charge anything because we make a commission if we sell you one of these policies. Okay, just like your auto insurance agent or your home insurance agent, if they sell you a policy, they get paid a commission. So if we sell you any one of these policies, we make some money. Okay. Number two, they say, hey, Carlos, if we do business with you, they're going to charge us more money. And that's absolutely not true. If you wanted to go to the online universe somewhere and look for all these quotes, you're going to see the exact same things I see here. There's no change in premium. The insurance companies are more than happy for you to buy it direct to them and not pay us a commission. They're more than happy to do that. Okay. However, we're your insurance agent, we're your advocate, we're there for you because we get paid to be your insurance agent. Okay. And then the third and final thing is they say, Carlos, you're only going to show me the plans that pay you the most commission or that you're contracted with or whatever other thing they may be thinking about. And the answer is absolutely not. If you said you want Joe's Chicken and Waffles, we're going to go with Joe's Chicken and Waffles. It's your policy. I'm just showing you everything that's available and what we recommend. And we're going to recommend the ones that are affordable, popular, and have a lot of people on the books. Okay? Now, this is what we recommend. $130.40 for Medico. Okay? So now, how do these two cards work together? How does your red, white, and blue card and your Medicare supplement work together? Okay? Well, it's very simple. Remember, this is your primary insurance. This is the one you show wherever you go. This is the one that's going to cover 80% of all the doctor and hospital bills. Okay? And then this is going to cover the other 20%. The only thing that you're going to be responsible for is whatever the Part B deductible is for that year. And this year, that Part B deductible is $226. So you literally have to have 226 singles in your sock drawer to cover all the doctor and hospital bills for 1 year. Okay? So let me give you two real world examples. The world comes crashing down on us and we have to go through $500,000 worth of cancer treatment. We're going to walk into the cancer center. We're going to show them our red, white, and blue card, and it's going to cover 80% of $500,000. Then we're going to show them the Medicare supplement card, and it's going to cover the other 20%. And you're going to pull out your checkbook or dip into your sock drawer and write a check for $226, and that's it. And the insurance company, Medicare and Medico, your supplement, cover the rest of the cost for the rest of the year. If they wanted to replace your whole body, they could. You wouldn't have to pay a dime after that, other than what you're paying monthly to be on the plan. Okay? So that's a little dramatic. Let's keep it more simple. If you want to go see a doctor and the doctor charges you $15 for the visit, how much are you going to have to pay? Well, you're going to have to pay $15 because you're responsible for the first $226. So 226 minus 15, now your deductible went down to $211. Then you go back, then you go to the doctor a month later, and this time he wants to charge you $20. How much are you going to have to pay? You're going to have to pay $20 because you still have a $211 deductible. Does that make sense? So you're responsible for the first 226. After that, Medicare and your Medicare supplement cover the rest of the cost. Okay? Understand? Does that make sense? Yeah, okay, great. Now, what's good about this, Ted? What's good about this combo is that when you have your red, white, and blue card as your primary insurance, you can go wherever you want, whenever you want. No one's going to tell you what you can and cannot do. They say that this card is accepted almost everywhere. They say 95% of all the doctors and hospitals in this country accept the red, white, and blue card as primary insurance. And wherever they accept your red, white, and blue card, they have to accept your Joe's Chicken and Waffles Medicare supplement as well. It doesn't matter if you went with Allstate, Medico, AARP, or Joe's Chicken and Waffles. Wherever your red, white, and blue card goes, so goes your Medicare supplement. Okay? Understood? We now know two pieces of the puzzle. We know that the red, white, and blue card, primary insurance, covers 80%. Costs us $164.90. We know our Medicare supplement is going to be with Medico, $130, covers the other 20%. We're just responsible for the other $226, the deductible, $226. Now, the third and final piece to option number one on the left-hand side is your Part D prescription drug plan. This is the card that you show at the pharmacy if you need to pick up some medications at the pharmacy, okay? So, it's pretty easy to shop for drug plans if you've done it a couple thousand times like we have, okay? What we want to do is we want to go to the mothership. We want to go to Medicare.gov. And here they say, plug in the list of your medications, the dosage, how often you take the medications. Tell us if there's a pharmacy you just can't live without. Then Medicare will sort all the plans from best to worst based on the medications that we plugged in, okay? So since we're doing a screen share, you're following along, we're vibing. Are you taking any medications? Okay, you are. Do me a favor. Go grab all your medications, put them in front of you, because we're going to start plugging them in. Okay, great. Take your time. They go shuffle around, get all their medications. All the while I'm in this. Find your health and drug plans. I'm grabbing their zip code. Okay, we're looking for Part D prescription drug plans. We don't worry about this for now. Do you want to see drug costs when you compare plans? We want to say yes because they're taking medications. Okay, great. So Ted, I'm ready when you are. What's the name of the first medication? Spell out a medication. Okay, so lisinopril. Perfect. And Ted, do me a favor. If say the name of the medication, if you can't say the name of the medication, start spelling it out. And as soon as I recognize the name of the medication, I'll say I got it. Okay. So lisinopril, I know that one. What's the dosage on lisinopril? 10 milligrams. And how many are you taking a day? And do you purchase 90 days at a time? Do you get quantity 90 every 3 months? Yes. Okay, so let me change this. Quantity 90 every 3 months. Okay. Ted, give me another medication.
Metformin.
Metformin. Okay. What's the dosage on metformin? 1,000 milligrams, and how many a day? Okay. And you get quantity 90 every 3 months?
Yes.
Yes. Okay. So 90 every 3 months. Okay. Another medication? Ted? Jardians? What's the dosage on Jardians? 25 milligrams, and how many a day? Do you get quantity 90 every 3 months? Okay. And Ted, another medication? Atorvastatin.
That's
Okay, dosage? 80 milligrams. How many a day? Are you buying 90 every 3 months? Quantity 90 every 3 months?
Yes.
Okay. Somebody say metoprolol? 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 Okay. Or metoprolol, I think the doctor pronounced it. Metoprolol. Okay. Ted, is it when you look at the bottle, does it say SUCC at the end of it or TART? Can you tell me what it says on the bottle? Is it succinate? It's SUCC. Okay. Just so you know, that means extended release. Okay. Okay. Extended release. What's the dosage? 50 milligrams. And how many a day? Okay. Do you get quantity 180 every 3 months? Okay. Perfect. Okay. And that's all your medications, right? You said, yeah. Okay, great. So what I'm going to do as the insurance agent is I'm going to take a copy of these. I've downloaded the Go Full Page Chrome extension. Go Full Page Chrome extension. All I have to do is click on this little button and it's going to take a PDF of this for me. And I'm going to save that PDF into his file, right? So I'm going to save it to my downloads. I'm going to say Ted's RX list for 2023. Then I'm going to go here. Before I move out of here, I'm going to save. I'm going to go into his files. I'm going to choose the file and I'm going to upload his list. Okay, that way I save it there. I'd save it there for later for reference. Okay. Okay, great. So let's move on. Now, Ted, tell me the name of the pharmacy that you're using at the moment. Okay. Are you open to other pharmacies if other pharmacies give us better pricing for the medication? Sure. Okay. So I'm just going to pick some of the more popular name brand pharmacies. And we'll take it from there. So I'm going to pick Walgreens. I'm going to pick Costco because it's here. I'm going to do CVS. Let me go a little bit farther. I can go a little bit farther like that, or let me see. Or I can type name. So here's Mariano's. Let me type Walmart in here.
I like Costco because I got 2% back.
Okay, so you like Costco? Okay, so let's take Mariano's out of here, and let's put Costco in here. Okay, great. All right, so we've plugged in 5 pharmacies. We're gonna hit done. We're gonna move forward.
Can we do the mailing?
Yeah, sure. If we're gonna do mailing, let me go back here. Let me erase one of these. I'll take Walmart out of here, and I'll do mail order. We are currently unable to process enrollments, but you can still view the plans. Okay, so I've never seen this before, but there must be something going on with Medicare.gov. Okay. Anyways, doesn't matter. Okay, so then we're here, right? Ted, I want you to look at something. There are 24 drug plans available in our area. I'm not smart enough to know how all 24 plans cover the tens of thousands of medications that exist in this country. Okay. We plug the medications in and Medicare.gov will do all the dirty work for us. They'll sort all the plans from best to worst, meaning which plan is going to be the most cost effective. They sort them by how much you're going to pay for your medications for the rest of the year, including how much you have to pay for the plan itself monthly, which one is going to be the most cost effective. And this is what it's telling us. It's telling us that this WellCare plan called WellCare Medicare RX Value Plus at $71.40 a month is going to be the best one for us. Okay. I want you to take a look at this number right here. $902.67. This is how much you're going to be paying for everything from start to finish, assuming that you're starting this plan June 1st. All the cost of your medications for the rest of the year, including the $71.40 that you're paying monthly starting June 1st, everything out the door is going to cost you $902.67. And check this out. Everything else just gets worse from here. So there's no need for us to outsmart the system. The system will tell us which one is going to work best for us. Okay? So, speaking out of character, if I see anything less than 3 stars, I'm making the excuse that we're not going with something less than 3 stars. Because once they get less than 3 stars, they got to start answering to somebody higher. Something's wrong. There's something going on. Okay. And if the one at the top of the list is somebody that I'm not contracted with, but the next one on the list is somebody that I am, and the difference between here and here is not that great, it's not going to hurt them that bad, then I'm going to go with the one that I'm going to get paid on. Okay, just letting you know. Okay. So this is the best one for us. So let's jump into the plan details, Ted. Now, first thing I want you to notice is this. Every prescription drug plan has a list of preferred, standard, and out-of-network pharmacies. Okay. It just so happens that this WellCare plan, all these pharmacies are preferred, which is a good thing. Okay. Out of those 5 pharmacies, let's see which one's going to be the most cost effective. 402, 402, 402, 437, and 478. So we don't want to do mail order. And if we want to save a little bit of money, we don't do Costco, and we do Osco, Walgreens, or CVS. Okay? Now, this is what you're going to pay on a monthly basis. So if we're going to Osco, in June, you're going to be paying $45 for all your medications. In September, you're going to be paying $45 for all your medications. And in December, guess what? You're going to be paying $312 for your medications. Okay? Now, you're going to ask me, why does it jump up so high? Okay? Well, let's take a look at this. They say that in December, you will enter your coverage gap or your donut hole. Okay? So let me quickly explain this to you. So I'm going to pull up. Where'd it go? Give me 1 second. I'm going to pull up this chart from the Kaiser Family Foundation. They do great work and studies and information about Medicare. And I like this chart right here. Okay, so prescription drug plans have 4 stages of coverage. The first stage is your deductible stage. This is where you're paying the full cost of your medications until you hit your deductible. Okay, so let's assume that you have $100 medication. You're paying $100 for basically the first 5 months out of the year, and then the 6th month you fall into the initial coverage phase. This is where the insurance company is going to say, "Hey, John, Ted, how about you pay a small copayment for the medication, and we'll cover the difference." So maybe you're paying $5 now for that medication, and WellCare is going to cover the other $95. Okay, you're going to pay the small copayment until everything that you've paid and everything that WellCare's paid, if that ever totals up to $4,660, then you fall into what we call the coverage gap, or the infamous donut hole. This is where the insurance company says, "Hey, Ted, I'm paying way too much for your medications. How about I need a break? How about you cover 25% of the cost of the medications, and we'll cover the rest." So now, this is where people freak out. Like in December, this is where people freak out and they say, "Carlos, I don't understand why I was paying $5 for my medication before. Now I'm paying $25. What gives? Nothing has changed. The medications haven't changed. The plan hasn't changed. I'm going to the same place. Why is it $25 now?" Well, it's likely because you fell into your donut hole or your coverage gap. Let's take a look. And sure enough, there it is. Right? So you're going to stay in this donut hole. You're paying 25% in this donut hole until everything that you've paid, deductibles, co-payments, 25%, everything that you have paid has totaled $7,400. Then you fall into your catastrophic stage. This is where the insurance company says, "Okay, you've suffered enough. How about you just cover 5% of the cost of the medications, and we'll cover the rest." Does that make sense? So initially, you're paying more. Sorry. You're paying more, then less, then more, then less. It's like a seesaw. More, less, as you go out through the year. Okay? Now, you might be wondering what the retail cost of your medications are. Okay? Give me 1 second. let me check something out. Give me 1 second. Let me see if one of these medications is okay. So all these medications are in the formulary. Okay. Now, atorvastatin, lisinopril, metformin, those are all free medications throughout the course of the year. And you might be asking, well, Carlos, I thought you said I had a deductible stage. I thought you said that I have to pay the full cost of the medications until I hit my deductible. Yes, however, the insurance companies will often help you with the very tier 1 generic medications that everyone is taking. So oftentimes they don't make that subject to the deductible. They just help you out right away. And in this case, that's what they're doing for these tier 1 medications: metformin, lisinopril, and atorvastatin. Okay, but let's take a look at metoprolol. What's the retail cost of metoprolol at Osco? Well, here you go. The retail cost for metoprolol is $27.99. Okay. Actually, this plan doesn't have a deductible. So this plan doesn't have a deductible. That's why they're helping us right away on these medications. Okay. So this plan, even though the cost of metoprolol is $28, you're paying $12 for it after the deductible. The one that's costing us a pretty penny is Jardiance. Jardiance has a retail cost of almost $1,900, but they're helping us out right away, $33. But as soon as we get into the coverage gap, it's $467. Make sense? Okay, so now you know. So now you know your Part D prescription drug plan. Let me take note of this. What was it? 7140? Okay, so now you know the meat and potatoes of Medicare. You got your red, white, and blue card that's going to cost $164.90. You have your Medicare supplement that's going to cost $130.40. And then you have your WellCare prescription drug plan that's going to cost $71.40 a month. Okay. Total is $366.70. Total. $366.70. Okay. Now remember, Ted, I told you that Medicare has nothing to do with the extra bells and whistles that people want or people had when they're finally getting on Medicare and retiring from work. If you want a dental and vision policy, you have to budget for about $65 a month. A good dental and vision policy will cost you right around $65 a month. Okay. And then if you want the gold standard in your Medicare, you have to budget for another $60 for a cancer policy. A $30,000 cancer policy is going to cost you about $60 a month. Now, let me explain to you why everybody wants a cancer policy. Everybody should have a cancer policy if you want the gold standard in your Medicare for the rest of your life. Okay. Number one, remember I told you that if you have your Medicare and your Medicare supplement, all the bills will be covered except for $226. So why would you need a cancer policy? Well, what if the doctor says, hey, Ted, I need you. What if Dr. Dilip says, hey, Ted, I need you to try out this experimental treatment. I need you to be part of this clinical trial. We're seeing great results and saving people's lives. Medicare is not going to mess around with that. So how are you going to get into those things? How are you going to pay for it? You need a big fat check from a cancer policy that's going to help you pay for those things. Okay, you need money. That's reason number one. Reason number two, what if the Dr. Dilip says, hey, Ted, I need you to drive up to the Mayo Clinic in Minnesota because they have the machines, they have the technique or procedures that are going to save your life. Who's going to help you pick up all your life here, drive up to Minnesota, and live out there for 2 or 3 weeks to get your treatment? No one's going to help you out with that. When you get there, the bills are going to be covered, but who's going to help you say, hey, son or daughter, I need you to take 3 weeks off of work because this is going to be tough for me. I need you to come with me, right? Who's going to put gas in the car? Who's going to say, what if you need to drive to your cancer treatment and it's an hour and a half one way? You go there today, you come back today, and you have to do that 5 days a week. No one's going to help you out with that. That's where you need a big fat check from a cancer policy. Okay. Reason number 3, a lot of these chemo treatments are going to oral chemo medication where you're popping some pills. These cancer treatments, pills, they're not cheap. And even though you have a WellCare prescription drug plan, it still may cost you $3,000, $4,000, $5,000, $6,000, $7,000 a year to take these chemo medications. Who's going to help us pay for that? When the doctor says, hey, I need you to take this medication for the next 3 years, no one's going to help you pay for it other than your own pocket. That's where you need a big fat check from the cancer policy. Okay. And the fourth and final thing, we know that people get surgery from cancer. If I get surgery today, am I running a marathon the next day? I'm not. I have to recover. There's some time that I need to get myself right. Somebody still has to pay the bills. Somebody still has to keep the lights on, food on the table. Who's going to help you pay for that? That's where a big fat check from a cancer policy would help us. Okay. So if you want the gold standard in your Medicare for the rest of your life, like everybody else has, then you have to add on a cancer policy. So the gold standard.
You have one?
Yes.
I know I could run a marathon, even if I didn't.
So the gold standard, we're going to add $65 for the dental policy and $60 for the cancer policy. We're at $491.70.
So I have heard like Part B covers some of the drugs, the expensive drugs.
Yeah,
How
so
about
Part B will cover the infusion medications, the chemo treatments that you get administered intravenously from a hospital setting or a provider, right? Again, when you go to the Mayo Clinic, all the bills are going to be taken care of, except for the $226, right? If you drive an hour and a half to the cancer center, don't worry about the bills at the cancer center. They're going to be taken care of. It's all the other stuff in between here and there that's not going to be covered, right? So again, gold standard is gonna cost you $491.70. Okay, Ted. Now forget about this. Forget about everything we just talked about. Let's talk about option number 2. Option number 2 is what we call Medicare Advantage, also known as Part C. If you decide to go on a Medicare Advantage plan, you're telling the whole world that you no longer want to use this red, white, and blue card. That you're going to put this red, white, and blue card in a drawer somewhere, and you're going to keep it safe, and you're going to replace it with a private insurance company's all-in-one Medicare Advantage card. When you do that, Ted, now you have to follow their rules. And one of their biggest rules is you have to use their networks of doctors and hospitals. You can't just go to the MD Anderson Cancer Center because you feel like it. You can't just go here, there, and there when you feel like it. If the doctor or hospital is not in the network, you're not going to get any benefit from your plan. Okay. Also, it's more of a pay-as-you-go plan. If you're going to use the insurance, there's going to be affordable co-payments every time you use it. For example, if you go see a doctor, it may be $5. If you go get lab work, if you go see a specialist, it may be $20. If you get lab work, co-payment, x-rays, co-payment, 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 co-payment. There's co-payment for about 90% of the services. Okay. However, there are 3 things that don't have a co-payment. And that's not a good thing. Chemotherapy, dialysis, and durable medical equipment like wheelchairs and oxygen tanks, diabetic supplies, things like that. Those 3 services, you're paying 20%. You're paying 20% until you hit a number. And that number, that safety net, is called the maximum out-of-pocket. And for a Medicare Advantage plan, that can be $3,000, $4,000, $5,000, $6,000, $7,000. Who knows? They're not all the same because they're not all created equal. They're all different. Okay? So, Ted, I just told you all the bad stuff. I just said private insurance companies follow their rules, use their networks of doctors and hospitals, affordable co-payments as you use services, and deductibles and out-of-pockets for some major stuff. So what's all the good stuff? Well, Ted, all the commercials, all the radio ads, all the phone calls you're getting, when they say, Ted, you can get a Medicare plan with this, this, and this, and this, and this for $0 a month, they're not lying to us. Medicare Advantage plans are usually $0 a month. There's nothing extra you have to pay to be on a Medicare Advantage plan. The only thing you have to continue to pay is what you're paying Social Security for original Medicare. And that is $164.90, and they're taking that straight out of your Social Security check, right? You don't have to pay anything for an Advantage plan. There's $0. So you don't have to pay $130 for a Medicare supplement because that coverage is already included. You just have to pay your co-payments as you go. And you don't have to pay $71 for a prescription drug plan because Medicare Advantage plans are all in one. They have the drug plans usually already included. And then when the commercials tell you, John, you can get a Medicare plan with dental, vision, hearing, gym memberships, over-the-counter reimbursements, telemedicine services, grocery cards, debit cards, and all these extra bells and whistles, oftentimes they're not lying to you. Medicare Advantage plans come with a bunch of extra bells and whistles at no extra cost. So the only thing that you have to put on here if you want the gold standard is, again, we go back to that cancer policy. A cancer policy, you're going to always need no matter what. So the gold standard and option number 2 is going to cost you $224.90 a month. You see? So there's the difference. You have option number 1, $492, let's say, and option number 2, $225. Now, some people will ask me, Carlos, which one do you think is best? Should I go with the Medicare supplement or should I go with the Medicare Advantage plan? And frankly, Ted, either one is perfectly okay. Either one you get is better than anything you have right now. Medicare is the best thing in the land. The only time I make a strong recommendation one way or the other is if you're already sick and you can afford the Medicare supplement payment, that's the only time I'm going to make a strong recommendation, because the best time to purchase option number 1, the Medicare supplement, is 6 months before you turn 65 or 6 months after, because in that year window, if you want a Medicare supplement with any one of these insurance companies, all you have to do is fill out an application and they have to give it to you. No medical questions, no nothing. They have to give it to you. If you come to me 7 months later, after you turn 65, or 5 years later, and you say, Carlos, I want a Medicare supplement now. Well, no, it's no longer open enrollment. Now we have to fill out an application where we have to answer medical questions. We tell them about our medications. They look into our medical records. And now all these companies, Medico has the right to say, I don't want Ted. He's already too sick. He's going to cost us too much money. That's the only time I make a strong recommendation. If you're already sick and you can afford a Medicare supplement, I say, let's stop messing around. Let's just go with the Medicare supplement. It's always easy to go with the Medicare supplement into a Medicare Advantage, but it's not always easy to go the other way around, from an Advantage to a Medicare supplement. Okay? So let's take a look at the Medicare Advantage plans that I recommend for you. So first, I'm gonna take a copy of this prescription drug plan and save it to his file. I'm gonna go TED 2023. Yeah.
Can you activate a Medicare supplement before the age of 65?
No, you can't activate the supplement before your Medicare effective date. On the effective date or after the effective date is when they can. Okay, let's go back here. Now, same way we shop for drug plans, we shop for Medicare Advantage plans. We go straight to the source, Medicare.gov, and all we have to do is click on this little button here that says View Medicare Advantage Plans Available. Okay, so look at this. There are 59 drug plans available in our area. Like I said, I'm not smart enough to know how all 50 plans cover the cost of your medication. So the system will sort the plans from best to worst. And here's what it's telling us. Oops, I'm sorry, I messed this up right there. And here's what it's telling us. It's telling us that out of the 59 plans, this plan with Blue Cross Blue Shield called Blue Cross Medicare Advantage Basic HMO is the best one for us. It's $0 a month, and all your medications are going to cost us $470 for the rest of the year. Anything else? Oh, $470, that's the same thing. $470, they're all Blue Cross Blue Shield, that's the same thing. Okay, devoted. See, everything's going to get worse from here. Okay, so now, before I recommend one for you, my next question here is, do you have a primary care physician that we just can't live without? If so, what's the name of that primary care physician? Okay, so the first thing I'm going to do is I'm going to Google it. Okay, did you say Dr. Priya Dilip? And you said, what city is she out of? Oh, she's out of Schaumburg. Oh, you meant Hanover Park? Okay, good. Or Bartlett? Okay, good. Okay. All right, so I got their information. Okay, so first, let me go here and let me make sure she's in the network first. Okay, so I'm going to go to plan details. I'm going to scoot over here to view provider directory. I'm looking at Advantage Basic HMO, right? I'm going here.
Did you change the up there?
I need to change the zip code here. What was the zip code?
60103.
60103?
The Bartlett is 601.
60103. No, 60. What was that?
606.
60634. That's where we're doing the searching, right? Okay. Now I'm gonna put delete. Right, Priya Dilip. Okay, fantastic. She is in the network of the plan. You can see here, we're looking at Blue Cross Medicare Advantage HMO, and this is her. Okay, so now, this is the one I'm going to recommend for you, Ted. Okay, so let's look at this first. Co-payments to go see your primary care physician, $0. Co-payment to see a specialist, $25. Diagnostic tests and procedures, anywhere from 0 to 50. Lab services, 0. Radiology services can range from reading an X-ray all the way to an MRI, 0 to 175. X-rays, $0. Emergency room, $120, and then urgent care. If you're going to use one of those immediate clinics around your area, like next to a McDonald's, it's going to be $25 there. Okay. This is one of the worst case scenarios. If you're an inpatient in the hospital, it's $195 co-payment every day that you're in the hospital, but only for the first 7 days. So if you're in the hospital for 3 weeks or 3 months, it's $195 times 7 days. That's $1,365. That's one of the worst case scenarios. Okay, again, 3 weeks or 3 months, your room and board is going to cost you $1,365. Okay. Now remember I told you that there are 3 things that don't have co-payments. That's durable medical equipment, dialysis, and chemotherapy. Remember I told you how much you're paying? 20%. You're paying 20% until you hit this number right here. This is what we call the maximum out of pocket, $2,500. Okay. Now, it's very unlikely that you're going to hit the $2,500. They say 4% of people that have Medicare Advantage plans ever get to the $2,500. Okay. How many times do you have to go see your primary care physician at $0 to reach $2,500? You'll never get there. You can go 1,000,000 times, infinity times, and infinity times 0 is still 0, right? Because your copayment to see your primary care is $0. If you go see your specialist 10 times a year, 10 times 25 is $250. You'll make a small dent into the $2,500. 2,500 minus 250, that's $2,250. It's very unlikely that you're going to get here. The only time that usually people get here, those 3 things,
And
chemotherapy, dialysis, and durable medical equipment, or if you're in the hospital a few times a year, right? But other than that, you're not going to get there. Okay? So there you go. Now we know that our Medicare Advantage plan is going to be with Blue Cross Blue Shield. And it's $0 a month. There you go. Now you have your two primary Medicare options. Option number one, supplement, go where you want, when you want. No one's going to tell you what you can and cannot do, except you got to make a payment, and they're going to increase your premium every year. That's just the natural rule of insurance. Option number two, more affordable on the front end. However, you're going to pay as you go. However, you get extra bells and whistles. And we haven't even talked about the extra bells and whistles, but we'll get into that, Out of character for a second. If you want to see what the extra bells and whistles are, then you go to Medicare Center, right? You go to MedicareApp is usually where I'm going. I'm going to plans. 606 what? 60634, Cook County. Oh, forgive me. Blue Cross Blue Shield isn't going to be on here because our Blue Cross Blue Shield contract is somewhere else. Okay, so what you're going to do, BCBS, Illinois, Medicare. Shop for Medicare plans. You're going to grab the zip code 60643. 34, 60634. Quote and apply. No, this isn't the right place.
So Blue Cross stays out of the city.
No. The Blue Cross is in there, except our Medicare Center is not loaded with Blue Cross Blue Shield because our Blue Cross Blue Shield contract is with another company.
So if you want to sign up somebody with Blue Cross, where do you go?
If you want to sign somebody up for Blue Cross, you have to go to your Blue Access for Producer portal, right? So I'm glad you brought that up because that's likely where I'm going to go to get this here. The Blue Access for Producer portal. You click Illinois. You log in. I'm going to log in with. Give me a second. Okay. I'm going to go to Medicare. I'm going to get select. I'm logged in as the agency. I have to log in as the individual. Give me 1 second. Forgive me. I can't log in right now, and it'll take me 5 minutes to reset the password and all that jazz. So this wasn't a good example for how to get the benefits. If any other carrier, if we're going to our Medicare Center and we go to MedicareApp and we type in 60634, all the plans are going to be here, right? Except for Blue Cross Blue Shield. And we want to get the summary of benefit, the extra bells and whistles. Click on plan details and scroll all the way down to the bottom until you find summary of benefit or the evidence of coverage. I personally like looking at the evidence of coverage because it's more detailed, but if you wanted to look at the summary of benefits, you could. And here you can Control F, OTC or dental or vision or whatever it is, or chiropractor, whatever it is that you want to see. Okay. So You explain, if they want to hear the extra benefits, I'm going to tell you right now that I don't really go over the extra benefits. I don't go over the dental, vision, and hearing and the gym memberships and all that stuff unless they ask me. I make the medications, the doctors and hospitals a priority. And if they want to get into the details, if they're interested, if they say, hey, my friend has $5,000 in dental benefits, okay. Well, if you want to go $5,000 in dental benefits, then it's not going to be Blue Cross Blue Shield. It's going to be such and such company. But now look at what it's doing to the medications. So it's $1,000 more on the medication. Is that worth it to you? To get $5,000 here, but lose $1,000 here? Yes, it's worth it to me. I'm going with the $5,000. You know what I mean? So
Usually works with the duals, Medicare, Medicaid, because they don't pay
correct.
for the medications. So they're more interested into the.
benefits.
That's true. But who brings it up though? Like, do your duals bring it up? My duals don't bring it up. My duals don't bring it up. My duals.
Sometimes they do.
Okay.
They have.
Yeah. Well, if they do,
Yeah.
then yeah, you have to.
They want the healthy card and
Sure.
also flex card, all the
Sure.
stuff. They
So
ask.
now this is where you have to buy a little bit of time and say, okay, give me a little bit of time, and I'm gonna find the one that's right for you in your area. Because you may not be aware of the plans that are in New York or something like that. You're gonna say, okay, give me about half an hour. I'm gonna call you back at this time. And that's where you go start searching the summary of benefits on each plan that's there. Right?
Do sometimes.
Well, it is what it is. But I'm telling you that 99% of the clients, for me, they don't ask. Okay.
So about the Part B premium, can they get it like a bill for a Part B premium? Like,
Yeah, if they're not collecting Social Security. So Sangeeta asked, can they get a Part B premium bill? Well, the only way they get a Part B premium bill is if they're not collecting Social Security. Social Security gets their money by taking that out of your Social Security check before they deposit it into your bank account. If they can't grab it, then they're going to send you a quarterly bill. So every 3 months, you're going to have a bill for $164.90 times 3, right?
One of my client got a bill of 8 months.
Yes.
And they were perplexed.
Yeah. So the first time you get the bill, you have to be ready. You might get 3 months, you might get 4 months, or you might get 5 months. That's usually what I've seen, right? 8 months is a different story. You have to figure out with Social Security why they got 8 months. Okay. But usually, if you're not collecting Social Security, you're going to get a bill in the mail and you have to be ready. It might be 3, 4, or 5 months in the mail. Okay. The very first time. And that's it. Which one do you want to do, Ted? Are we going with option number 1 or option number 2? You tell me. Okay. So let's go Medicare Advantage. Okay. John, you asked any pre-existing on the cancer. Forgive me, I didn't see the message. We do have to answer some medical questions on the cancer policy, but the medical questions usually revolve around AIDS and ARC, and if you've had some sort of cancer treatment within the last 12 months or something like that, or 5 or 10 years. I'm not 100% sure. Okay. Any questions on this? This is how we do the presentation from start to finish. I did like a long version because I even went into the different stages of coverage in the Part D prescription drug plan, which I usually don't, but I wanted to get super detailed with you guys so that you see how to go through it from front to back.
Just curious to know, how many of your clients ever asked you if you have the cancer insurance policy yourself?
But nobody asked me. Nobody asked me. The only thing I have extra on myself is obviously life insurance and an accident policy. I've had an accident policy on myself for me, my kids, and my family for a long time. Because it helped me out very well when I fractured my ankle. I didn't have to pay a dime because I had an accident policy with Allstate. A $4,800 bill turned into $0 for me. So I always tell that story and it always hits.
Cheap accident.
Yeah, $25. Yeah, super cheap.
We
Super cheap.
had from Discover, so
Yeah.
it has got a.
So let me stop recording this. Does anybody have any questions on this? Is there anybody else? I've always had Allstate. It used to be it used to be called National General, but now I get they're an Allstate company. Yeah.
So about the Social Security or about the $164.90, if you are collecting security, then only it can be deducted from the,
Correct.
otherwise you will get a bill?
Correct. Because how else would they get their money?
I thought either way you can deduct from the social security.
But if you're not collecting social security, how could they deduct from your social security check? Right? Yeah, no, it's only if you're collecting social security that they can dip into social security. And just for reference, just for your understanding, only the plans that are regulated by, let's call CMS, are the ones that can dip into your social security check. That's original Medicare, that's Medicare Advantage, and prescription drug plans. Anything else cannot dip into your social security check. Medicare supplements, they're not ran by CMS, they're ran by the states.
So
Right.
they get a EFT.
Right, EFT or a bill in the mail or something like that. But when they ask you, can you just take my supplement out of my social security check? No. Those have to come out straight out of your social security, your checking or savings account.
The cancer policy.
Checking or savings account. Is it ran by CMS? No, it's got to be checking or savings account.
Life insurance, you can have them take the money from Social Security.
Oh, I have no idea about that. Is that possible? I have no idea. Life insurance policy?
I have.
Oh, I had no idea.
If you have to give them their.
Like permission? Oh, I had no idea. I had no idea. So then maybe it's possible. Say it again. Oh, hold on one second, Mo.
Life insurance.
Most famous.
Yeah.
Can't hear most.
I think some life insurance policies, they allow you to pay to, if you give them the permission, they can take the money directly from your
Okay.
social security.
So I didn't know that was possible.
Yeah.
Is that so? Then, if they can do it with life insurance, can they do that with supplements?
Yeah, 100%.
Oh, okay, yeah. So I don't know, but as far as we're concerned, on the applications, the only ones that give us the options of Social Security check are Advantage and prescription drug plans.
There is a coupon book option. What does that mean?
That means that
Bill.
a bill in the mail. Yeah. Okay. Any other questions on this? Okay. Let's take 5 minutes, stretch a little bit, and we'll come back and we'll finish this stuff off. I want to get out of here early because I'm struggling.
Yeah.
So I'm going to do a mock enrollment, right? So if a client finally says, hey, okay, yes, I'm ready to go. That's what I want. I want my Medicare Advantage plan, or I want my prescription drug plan. Then I'm going to go to Medicare Center.
Okay.
I'm going to enroll into my Medicare Center. And then, so there's 4 softwares here. This is Medicare Center. Then you have MedicareApp, then you have Medicare Link, and you have CSG. Okay. I am so used to doing enrollments through MedicareApp, which is the software called Connection. Right. This is the software that I got familiar with long before, Medicare Center upgraded some things, so I usually tend to do MedicareApp for things. Okay, so I'm going to click on MedicareApp. It's going to take me to their software. Okay, first thing I'm going to do is I'm going to create a new profile. I have this screen open, and I have, let's say, testing screen open, and I'm just basically copying all the information that I have here from my conversation with them. I'm copying it over here, right? So 60133, Cook County or DuPage County, testing. If it is, let's just say 808-24-1958, and phone number. Are you talking to their representative or something? No, I've never filled this stuff out. So this stuff you can just leave blank. Okay. You want to hit save. You want to fill in their MBI, their Medicare number, right? Use their effective date. August 2023. August 2023. Okay. Hit save again. I'm sorry. Hit save. And then here's where you continue to scope of appointment, right? If you didn't collect the scope of appointment beforehand and you're collecting it now, continue the scope of appointment. And you have two options. You can email it to yourself or you can text it to them. Okay. If I text it to them, let's see what it looks like. So I just texted it to them. I'm going to pull up my text messages. And let's see. Seven seven nine 875 9786. Oh, okay, I got it. And that's not showing it. Give me 1 second. Cool. I don't know why it's not popping up on my computer, but it is on my phone. So
It is, okay.
it is on my phone. So I don't know if you can see it, but there it is. It says complete your scope of appointment. Blah, blah, blah,
Appointment, yeah.
right? So we're gonna hit that link.
Mhm.
I say, okay, did you get the text message? Okay, great. Click on the link and then tell me when you get to the next page. That's all I say. Tell me when you get to the next page. I wait. They say, okay, Carlos, I'm at the next page. Okay. At the very top or on that screen, you should see something that says scope of sales appointment confirmation form. Do you see that? Okay, perfect.
Yes,
All right. So now do me a favor. Scroll down just a little bit. And where it says, please choose the products that we're talking about today. I say, choose the first one or choose the second one. You know, whether I'm doing a prescription drug plan or a Medicare Advantage plan. I say, okay, choose the second line that says Medicare Advantage Part C and cost plans. Okay, did you check it off? Okay, great. Now scroll down just a little bit more where it says first name, last name, address, and phone number. First name, last name, address, and phone number. Make sure that's all correct for me, Ted. Okay, double check it. Yes. First name, last name, address. Okay. Phone number's correct. Okay, it's all good, Carlos. Okay. And right underneath the phone number, where it says, are we talking to your representative? We're gonna say no, because we're not talking to your attorney, we're talking to you, right? Okay, perfect. And right underneath that, there's a little checkbox that needs to put a check mark in. Check that off, and that says we agree to all this jazz. Okay, great, you got that? Now scroll down all the way down to the end and click the blue submit form button. Okay, great. Now, when you do that, you should get a thank you screen. Tell me when you see the thank you screen. Give me 1 second. Perfect. There's a little thank you. It says thank you. Your scope of appointment has been confirmed, or what it has been received. Okay, great. So now you as the agent, you're still on the screen while you're walking them through this whole process, right? And all you have to do is hit refresh. Once you hit refresh, you're going to see this button pop up now. You have to complete your part of the scope of appointment now. Okay, so you're going to click here. And now you got to fill your parts in. Okay, so Ted, that form that you just signed basically lets everybody that needs to know that you're giving me permission to talk to you about, Medicare Advantage plans or prescription drug plans, and frankly, sell one to you. So I have to keep it on file for myself. Okay, so let me fill out my part. So I fill out my part. Whatever, walk in or phone call in. I'm always doing phone call in. The plans that are represented, you can put MAPD, you can put PDP, you can put Met subs, whatever you want to put in here. I tend to like if we already picked the plan, I tend to just put like the plan itself, like a Humana MAPD or something like that. Right?
Yeah, me too. Mhm.
Okay, Humana MAPD. That's the date of our appointment. I check this little box, and this is where my signature comes in as the agent, right? So your agents will put the signature in here and submit form, and voila. Now the scope of appointment has been completed. If she ever needs a copy of it, or if anybody ever needs a copy of it, it's right here. You can go back into your Medicare app and pull it up if you ever needed to.
Okay.
Right? Okay. So it looks the exact same way if you're sending it via email. Right? So
Mhm.
there's an email. We'll see what it looks like. Here it is. Okay. Ted, you're gonna get an email from do not reply at drx.com. Do you see that? Okay. It's you got it? Okay, so in the middle of that email, there's a blue button that says complete scope of appointment form. Okay, do me a favor, click on that, and then it's gonna take you to another page. Let me know when you get to that other page. At the top of that page, you're gonna see something that says scope of sales appointment confirmation form. Do you see that? Yes, okay, perfect. Now scroll down just a little bit where it says, please choose the products that we're talking about today. Choose the second one that says Medicare Advantage, Part C, and cost plan. Okay, great. So I'm going through the whole spiel again. Okay, scroll down a little bit more. First name, last name, address, and phone number. Double check all that for me. Okay, great. Right underneath their phone number that says, are you the authorized representative? We're going to say no. And then right underneath that, there's a little box that needs a check mark that says we agree to all this jazz. You see it? Okay, great. Now click the blue submit form button. Okay, perfect. Did you get the thank you? Okay, great. Now let me go back to my part. Ted, that form basically tells anybody that needs to know that you're giving me permission to talk to you about these policies and frankly sell one to you. Okay, so I got to keep it on file for myself. Let me fill out my part. So again, I go through this whole thing, complete my schedule appointment. Okay, get that all done. Now, let me go. So again, the schedule appointment is done. Now we're going to click on continue to plans. And this is where we're going to select the plan that you guys spoke about, right? So let's say it's Humana. We're going to add to cart. We're going to select whether you want to send it to the beneficiaries so that they can sign and submit, or you want to complete and submit form yourself. Now, me personally, I've always selected complete and submit form myself. So I'm going to go here. I'm going to continue to apply. And here we go, right? Mr. Mail, phone number, all this stuff is correct. Okay, 123 Main Street. Okay. Do you have a different mailing address? No, everything's good. Okay, continue. Okay. Medicare number. Okay. Part A and B effective date, policy effective date. Okay, we wanted to start August 1st because that's when our Medicare starts. And this is where you got to select the code. I'm new to Medicare or anything else. Usually is I'm new to Medicare, or it's if it's AEP, then you don't have to select anything. So just so you're aware, there's no button that says we're in the annual enrollment period. If we're in AEP, just leave it blank and move on. Okay. But let's say we're in the middle of the year. I'm new to Medicare. Okay, great. Will you have any prescription drug coverage through these things? We're gonna say no. And hit next. Okay, please correct the errors. Okay, let me pause recording for a second. Let me just pick one, just so we can move on. Give me 1 second. Okay, so we just put in a Medicare number so we can move on. Okay, ethnicity and race. I usually don't ask. This is just like a census thing. I'm not interested in asking these questions, so I usually just put choose. I choose not to answer. Obviously, if we're dealing with HMO plans, we have to pick primary care physicians, right? If we're not,
Mhm.
then we say no. So we find a primary care physician through the provider search. We put in their name, provider ID, um, and move on. In this case, I'm not going to bother right now, or I guess I will just do physician search. It takes us to the Humana physician search. We're going to type in a zip code 60133, 15 miles. We're going to go Medicare, and we're doing the HMO, Go plus HMO. We're going to hit next, and we're just going to, I don't know, pick the top, or just pick primary care, all primary care physician specialties. Okay. So here we go. Right. Okay. So we're gonna get their name.
Mhm.
We get their name. I copy it. I go here. Physician up there, and the provider ID. I'm gonna go back here. Provider ID. And move on. Right. Are you an established patient there or not? Yes, I've been going there for years, and no, this is something new to me. Right. And then, how do you want to make your premium payment now? Um, Obviously, most Medicare Advantage plans are $0 a month, right? So
Mhm.
we just have to pick something. However, I'm always usually selecting deducted from your Social Security check if you're already collecting Social Security, okay? Because they may not be aware, we may not be aware that there is a late enrollment penalty somewhere, or some sort of extra money that they have to pay. And if we don't give them a chance to take it, and nobody notices it, and then they lose their Medicare, that's a problem, right? So I just use this as a safety net, right? If they're not collecting Social Security, then um, I'll ask them, like even though this is $0 a month, I just want to make sure that if there's some sort of penalty that we're not aware of, that they have an opportunity to get their money. Because if they don't get their money, and you're not aware of it, and you go a few months without paying them the whatever money they want, then they cancel your policy, and now that's a bigger issue than anything else. So whenever you can do this, that's great. Whenever you can do that, that's okay too. And last resort is sending them a coupon book, in my opinion. Okay. So, all right, collecting, deduct my $0 for my Social Security check. Okay, bam, bam. These are just optional. I just leave this blank, but if they really want it in a different language, or if they want audio, large print, or whatever, you can choose this stuff. Are you a veteran or not? I asked them, are you a veteran or not? No, I'm not a veteran. And then this doesn't matter. Next. Okay, great. So now this screen, this is the end of it. Okay. Now I make sure to open up these three tabs. Okay. Because I'm gonna double check my work. There's been plenty of times where I don't double check my work, and I
Mhm.
accidentally put in the husband's Medicare number as opposed to her Medicare number. Does that make sense? So
Yeah.
you always want to open this up. You always want to open this up and make sure that it's all correct. Okay. I'm not going to
Mhm.
open this Medicare benefit information because I have my stepdad's Medicare number on here, and we're recording
Yeah,
this.
that's fine. Mhm.
Okay. But yes, double check all this. All right. Make sure this is all correct. We're good to go. Good to go. Good to go. Everything was good. Okay. You're reading all this stuff. Mm, This is something new. I haven't seen this in a while. Forgive me. Hold on one second. I haven't seen this. This is new. Section 1, the applicant.
So I'm sorry, that what's in red now we have to read probably? Is that like a script that we're reading to the client?
It looks like it. Yeah. Yeah, it looks like we have to read this little
Okay.
right? The
Mhm.
following language is required for field agents when conducting enrollments over the phone. Okay. I, the applicant, and Humana Benefit of Illinois acknowledge and agree to the following provisions. I am enrolling and using electronic transactions, blah, 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 blah. Okay, if they agree, thank you. I will now read the second set of statements. Okay, and I guess it's just giving you directions if there's multiple applicants listening, right? The second section, enrollment in this plan usually is for an entire year. Once you enroll, you can leave, blah, 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 la, la, la. Okay. If the applicant agrees, thank you. I will now read the second set of statements. Humana, la, 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 la. Seems like a lot, but I guess if we have to read this, we have to read it. You know, I agree. Okay, bam. I understand my signature. And then I am the person listed on this enrollment form. And then obviously we're over the phone. Due to physical limitations, I am unable to sign my name. And this is where I just type in the applicant's name.
Okay.
Ted testing. Right here. Okay. If for some reason you don't feel comfortable doing it this way, you can always go back to the very beginning where it says send the application to the client, right? But we've done thousands of these before, and this is how we do it, right? I've asked Premier a billion times, like, hey, are you sure that I can just select this and type in their name? Is that cool? And they've reassured me that it's a yes. Okay.
Okay.
So I'm comfortable with doing it. This is how I've done, all my enrollments. I'm recording on my phone calls, so it's not like I'm doing anything shady. They understand what I'm doing. They're hearing what I'm doing. We're doing a screen share. They see exactly what I'm seeing. So I'm comfortable with doing this stuff this way, right? So
Okay, so this whole process with the application, they're also on the screen share.
yeah, 100%,
Oh,
100%.
okay.
Yeah, I'm always doing a screen share like this, And if I'm not doing a screen share, like for some reason we can't get connected, I'm still doing it this way. Obviously I'm recording the phone call,
Yeah.
and I guess I'm supposed to read these statements, which I will now,
Mhm.
you may not have these statements if you do, let's say, a WellCare plan or a Cigna plan or a United Healthcare plan.
Mhm.
The enrollment process can be a little different for each carrier, but generally the beginning is the same.
Okay.
How you collect a scheduled appointment, how you input the client's information, select the plan, fill in all the information. It's this last part, when you get to this last page, that this section may be a little different.
Okay.
You may not see this on United Healthcare, you may not see this on Aetna. We are seeing it on Humana. Okay, you'll get used to it. But okay, put in their name. Do I give permission? CenterWell is their
Mail order
mail
pharmacy.
order pharmacy, right? So I say yes here. I usually just say no on the rest of the stuff. Because I don't want them getting a bunch of phone calls. I don't want them to get a bunch of marketing stuff, but this CenterWell stuff I usually say yes on, right? You are not required to share this information with Humana. Okay, I'm just gonna put no here and then hit submit, and voila. When you get to the next screen, there's gonna be like a thank you screen,
Mhm.
and there's gonna be a link where you can download the application. So if you want to download the application and save it for your records somewhere else where you keep all the client's information, all the client's files, you can do that. If not, then it's just going to be in your Medicare app whenever you need to grab it. Okay. On the next screen as well, you're going to have the HRA button, right? Where the health risk assessment. So if you wanted to get an extra $50 or $70 or whatever it is that they're paying, then you're going to click on that and you're going to start the whole health risk assessment. And the way I tell my clients is this: I say, okay, clients, so Medicare Advantage plans, they get rewarded if they keep you healthy. The healthier they keep you, the more money they make, right? So we're gonna take this health risk assessment, pretend like we've never even met, pretend like you like I'm just a robot and you're just answering these questions like we never even spoke to each other before, because they're gonna get a little bit personal. Okay. All right, great. Let's do this. Da, 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 da. Hey, do you feel lonely? Are you depressed? Do you need some friends? You know, things like that. Okay, great. Thank you, Ted, for doing that for me. Like I said, they use that information to uh, um, figure out or get information on how best to give you care. Okay, so I appreciate you doing that. Other than that, Ted, this is it. We're done. We just submitted the application for your Medicare Advantage plan. It usually takes about 2 or 3 weeks for it usually takes about 2 or 3 days for them to process the application. And then it takes about 2 or 3 weeks for all the paperwork to come in the mail, like to physically have it in your hand. It usually takes about 2 weeks. So sit tight. If you know this plan starts June 1st. Okay. 2 or 3 weeks from today. So this plan starts June 1st. That's when your insurance starts. If you don't have the paperwork in hand and you need to go see a doctor, go see a doctor. You have insurance in the universe somewhere right now. You just physically don't have the cards. If you need the numbers and the cards, call me. We can call Humana together. I'll get the numbers that we need to transfer it over to any doctor or hospital that needs it. Okay. Give me 1 second. Let me blow my nose.
Allergies all year.
Okay, so yeah, so this is it. Anything else? We're all good. Okay, great. I appreciate you giving me some time. Don't forget, if you know any other people, you have any classmates or other people that are turning 65, don't be afraid to send them my way. I send you a small little referral fee, $10, and we send $5 to St. Jude's in your name as well. So we'd appreciate it. Okay, great. See you later. Take care. Bye.
Okay. So, a quick question. So
You want
do
me to
you
keep recording or
send
stop
them?
recording?
Yes. Yeah, no, if you could keep recording, please. So at the end of the enrollment, do you send them like the summary of benefits, the evidence of coverage, and
You know what? Honestly, I don't.
rating?
I honestly don't. Because they're gonna get all that stuff in the mail, you know.
Okay.
But if you wanted to, you could. With Radius Bob, I don't know if you have Radius Bob or not, but you can oh shoot, I'm still recording. Okay. I'll have to edit that part out.
Yeah.
Okay, so with Radius Bob, we can
Mhm.
upload the files. We can upload like summary of benefits, evidence of coverages, and whatever files else they need into their profile.
Mhm.
And then we can give them a portal where they can access that stuff. So
Ah,
if
gotcha. Okay.
the portal, they'll have a link and a password where they can see all the files that I'm giving them access to with Radius File,
Okay.
but the simpler way would be just to send everything, in an email. If you want to, that's fine too.
Okay.
Sometimes they'll ask me, can you send me a copy of the application? Okay, yeah. So I just email it to them right away,
Okay.
after I saved it or downloaded it.
Okay. So I know that you said you were talking about the app that the option where we have to send a link to the customer. Radius Bob, I haven't used that. What percentage of your clients actually use that link to log into their own portal?
Not a lot,
Not a lot. Okay.
not a lot, I mean, the truth is I don't send it often,
Okay.
because I don't have clients asking me for things, and usually if they want a copy of their insurance card, I just like email it. You know what I mean? I haven't
Okay.
been too,
Makes sense.
I haven't been too good about sending them enabling access to their portal,
Okay. Yeah, that
but
makes
but
sense.
but but if you want to use the system correctly, like,
Mhm.
and you want to use it to the best of its ability, then yeah, take advantage of jumping files into their profile and then selecting what files you want to give them access to, and then giving them a portal. That way they say, hey, Patty, I lost my my insurance card. Ted, log into your portal. And I've put your insurance card in there, so you always have it there, you know.
Okay.
Mhm.
Okay, well, I mean, along with the first
Yeah.
video that you recorded with this one, there's a complete presentation. So
Yeah, complete presentation from start. Hey, remind me who referred you to me? Okay,
Mhm.
great. This is how we're gonna do things. La 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 la. Are you ready? Okay. Let's work on the application, and that's what we just did right now.
okay.
We got the presentation from front to back. Let me stop recording.